In this lecture, you will learn about the pathophysiology of diabetes mellitus. First of all, we can define diabetes mellitus as a group of metabolic disorders characterized by hyperglycemia and abnormalities in carbohydrate, fat, and protein metabolism. American Diabetes Association classifies diabetes into four main types. The diabetes, and the third one is gestational diabetes, which is diabetes that was diagnosed during the second or third trimester of pregnancy, which was not a diabetes period to gestation. And a specific type of diabetes due to other causes like endocrine disorders like Cushing syndrome or disease of the pancreas like pancreatitis or cystic fibrosis, and also it can be due to medications like glucocorticoids. We will start talking about type 1 and type 2 diabetes in detail. If we start with type 1 diabetes, type 1 diabetes happens due to autoimmune destruction of beta cells of the pancreas, and this will lead to absolute deficiency of the insulin. Insulin is a hormone that keeps the glucose within the normal range, and then the cells use the glucose for energy and save the excess into the liver, muscle, and fat tissues. And it does this by taking glucose from the bloodstream to the cells. But when the pancreas cannot produce any insulin, the glucose remains in the blood. This type of diabetes accounts for 5 to 10% of all the cases. And it is known that it usually develops in children and early adulthood. If we talk about the clinical presentation of type 1 diabetes, the most common initial symptoms are polyuria, polydipsia, polyphagia, weight loss, and lethargy, which all accompanies hyperglycemia. And mostly the patients are thin and they are very prone to develop diabetic ketoacidosis. The second type of diabetes is type 2 diabetes. Type 2 diabetes develops due to progressive loss of adequate beta cell insulin secretion. And this type it is characterized by both peripheral insulin resistance and inadequate insulin secretion, which leads to relative insulin deficiency. And this type patients are often asymptomatic. And they are diagnosed by unrelated blood cells, and this type accounts for 90% of the cases. It is important to know that even though classification is important for determining therapy, most patients cannot be classified as type 1 or type 2 and at the time of diagnosis. It's not always straightforward at the presentation. And also the traditional that type 1 diabetes only develops in children, while type 2 diabetes only develops in adults, that is not also accurate. As it can develop, as it can both diabetes 1 and 2 can develop in both age groups. And also, once hyperglycemia occurs, both type 1 diabetes and type 2 diabetes patients can develop complications, microvascular and macrovascular complications. Complications include retinopathy, nephropathy, and neuropathy, while macrovascular complications include cardiovascular diseases, stroke, and peripheral vascular disease.